So what is shock? So shock is a state of inadequate tissue perfusion or low perfusion state. And why do we have low perfusion states? Usually it's associated with blood pressure. So think back about what do we need for blood pressure and to maintain blood pressure. You have to have adequate stroke volume, so the amount of blood ejected by the heart in one contraction. You need adequate heart rate. So our heart rate times our stroke volume gives you your cardiac output. So your cardiac output times your systemic vascular resistance, which is the amount of pressure the heart's having to pump against in our arterial walls, gives you your blood pressure. So if we have a problem with any of these, so shock is associated with one of three things. It's either a pump problem, being the heart, it's a piping problem, being the vessels, or it's a fluid problem, being mainly our blood. So if we have a problem with any of those, may lead to shock. So pump, pipe, volume are some of the main factors of shock, or are the main factors of shock. So depending on how your patient presents, we're going to do our assessment. Is it a pump problem? If it is, can we fix it? Is it a pipe problem? Means how is our vasculature? Is it dilated or is it constricted, etc.? And are there ways that we can correct it in a volume problem? So in a volume problem, if they've lost volume, they've lost blood, we need to replenish it.